Respiratory virus RSV is on the rise in parts of the country. Some hospitals are overwhelmed amid a shortage of the RSV vaccine. ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, is here with more on that. Dr. Patel, right now we're seeing a rise in cases in southern states, but health officials say it's just a matter of time before it makes its way north. What do you think people need to know about RSV and who's most at risk?
What people need to always remember about RSV is in any given season, this one virus will hospitalize thousands of children and other vulnerable adults who have underlying medical conditions. You know, RSV is responsible for over 2 million outpatient visits as well. So it's really debilitating towards the public health system. And as you mentioned, we are seeing a rise of cases in the South, in places like Texas and Tennessee, with some hospitals getting over 200 cases in 1 week. And this usually is a predictor of what's going to happen in other parts of the country. So people just need to be aware that these three viruses are circulating: RSV, influenza, and COVID-19, and prevention is everything.
Now, there are concerns that we could be headed for a so-called triple-demic with the spread of RSV, flu, and COVID all at the same time. We saw this last year. So how concerning is that, and how do you tell the difference between the three?
It's a loaded question, Diane, but I respect it because people should be aware of the fact that we're already seeing these seasonal epidemic levels of RSV in the South, and the future is going to tell us what's going to happen with influenza and COVID-19. It's important for people out there to realize you can't necessarily tell the difference at home. Yes, those tests for COVID-19 at home still work. You can get rapid tests for influenza at certain pharmacies and healthcare offices. There are tests for RSV, but in general, these are respiratory viruses, and symptoms can kind of appear mild for some people or serious for others. One thing that I would urge of all parents or anyone who are living with people who are high risk is to not hesitate if you see someone struggling to breathe and get into the hospital. And here's a pearl for all parents out there. RSV can actually be worse on days 3 to 5 of illness. So even if you have a child who has a runny nose, a little cough, I saw plenty of these kids at a Diwali party yesterday. Things could actually get worse on day 3 to 5. So just because things look okay in the very beginning, you still need to make sure you keep your guard up.
So as a mother of a child who has a cough, it feels like every other week, and is prone to these kinds of symptoms, what signs do you look out for to know when it's time to take them to the doctor, or more importantly, when it's time to take them to the ER? Because I was told things about nostrils flaring and muscles in the neck, and that was one of the things I found most helpful.
Absolutely. So anytime a child is really struggling to move air, they will start to use what we call accessory muscles. So they might be flaring their nostrils, using their shoulders to breathe. You might see their ribs as they're using their abdomen. The analogy I like to give people is, imagine you go outside and you sprint a mile and then you stop. You can imagine how you'd be breathing. If you ever see that type of breathing in a child, or anyone for that matter, they need to get checked out. It could be RSV, influenza, COVID-19. It could be pneumonia. It could be anything that's really affecting their ability to move air, and that can be devastating.
Now, a federal health official told ABC News that they're trying to get more doses of the RSV vaccine out there and anticipate tens of thousands of doses as early as this week. How much of a difference do you think that could make?
If this can be rolled out quickly, there can be more vaccines to kind of match the demand right now, especially for those higher risk individuals, those babies under 6 months with underlying medical conditions, and also individuals who are living in lower socioeconomic areas or places where there's barriers to access. This can make a huge difference, not only with making sure people have the protection, babies have that monoclonal antibody, which could potentially keep them out of the ER, but also this really helps with getting the word out and making sure parents know to go and get their vaccine, so people aren't driving or calling and realizing that there either is no vaccine or shot, or it's being saved for people who are higher risk. We need to make sure that we are absolutely on top of that so everyone can get this protection.
All right, ABC News medical contributor Dr. Alok Patel, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.